Hi, my name is Mary Steinbach. I'm a nurse practitioner at Huntsman Cancer Hospital in Salt Lake City, Utah. I work in the plasma cell dyscrasia program, taking care of patients with amyloidosis and multiple myeloma.
And my name is Eliza Parkin. I also work at Huntsman Cancer Institute in the same department as Mary. So I take care of myeloma patients and amyloidosis patients as well. So I think one thing that is really important is talking about safety with these medications with our patients because the safety profile is very important, and a lot of these medications and therapies can have significant toxicity. And so I think one of the most important things that we can do as nurse practitioners is being very aware of the safety profile of these medications, and not being afraid to look something up and look for resources, because it's really important that we are honest with our patients and that they know where to go to for help. I think the other big thing that we have done here at Huntsman is we have a triage center. So we have a number available for our patients at any time they can call, and they have availability to discuss with the provider on call about what if they're experiencing symptoms, and they know where to go for help. And so I think that is one thing that's really, really important. Mary, did you have anything else you wanted to add?
Well, I think you're right, building off kind of that triage concept. Often what patients are most afraid of is like what's going to happen overnight or when clinic isn't open. And so just making sure they know who to call. And then with some of the newer treatments we're using, we want to make sure whoever receives the phone call knows what to look for in terms of what the patient is describing, right? So um, having those systems in place makes delivering some of these complex therapies a little easier. I
Yeah.
think the patient safety, I always try to assess, well, first of all, you want to explain what the likely side effects are of any treatment that you're educating a patient on. But I always also try to get a sense of like, what is the patient most concerned about, right? Are they worried about being neutropenic because they live with their grandchildren? Are they worried about having a fever and being alone at night and not knowing what to do? So I think this is where, as nurse practitioners, we really have the power and the privilege to know our patients very well, and then understanding where each patient is coming from is helps me cater how I'm speaking to them about safety or adverse events that might occur from their treatments. Um, we were talking the other day in clinic. There was a period of time where patients were very afraid of CAR T cell therapy, right? And there still are a group of patients who just don't want to have anything to do with it because they think the potential toxicities may not be worth it. And so sometimes when you're talking about safety, you're debunking what they might have heard out there in the community or on a certain web page or in some sort of chat. So I think it can go both ways where you want to be transparent and openly let patients know kind of what to anticipate, but a lot of times we have to kind of talk them out of fears that may not be absolutely warranted.
Yeah, such a good point. I think one thing I also wanted to add is we've established really good relationships with the providers in our emergency department. So one thing that we have done is we have gone and given education on some of these therapies, whether it's a post-transplant patient or a post-CAR T patient or a bispecific patient that's coming in with adverse side effects, and discussing with them kind of what to look for and how to treat and how to call for help, and where to triage that patient. And so I think that's another thing that's definitely helped kind of instill some confidence in patients that you know when if they do and initially have to go to the emergency department or seek care outside of clinic hours, they know that they're going to be in good hands.
And I think the only thing I would add to that is just the caregiver perspective, right? Because it's very rare that you're having a conversation with just a patient. Often
Yeah.
their care partners are a part of it. And so providing education to them is equally important. Understanding, what their fears are, anxieties, or where they're coming from also is a really important part of it.